All right. Thank you everyone for, that lovely discussion that we had in our first part of the day. I have the pleasure of moderating this amazing panel, Stepping Out of the Clinic, Policy and Advocacy for Healthcare Professionals. As we kind of talked about in the first part of our event here, we really are prioritizing helping students and learners hone their advocacy and policy skills. As we talked about earlier, policy and advocacy is really crucial to advancing social mission and health professions education and just really advancing change overall. As we know that our healthcare system is really kind of in shambles at the moment, and we really want to empower our learners and folks that are coming up and through the pathway with these tools to really use their voice and take charge of whatever platform they're given. So today we have two amazing panelists joining us, and both of whom are healthcare professionals in their own ways. And one of them is our Advocacy Advisory Council member, Manisha Sharma, and we're also joined today by Dr. Amber Hewitt. I'm going to take a moment and introduce both of them, and then we will dive right into our questions, and I will be moderating the panel discussion today. So Dr. Manisha Sharma is a family medicine physician working at the intersection of social justice, patient care, health policy, system design, and clinical innovation. Dr. Sharma leads and provides strategic advisory support on multiple local, state, and national initiatives geared to dismantling structural racism in medicine and health inequities. She's a founding partner of the Civic Health Alliance, a nonpartisan coalition of health professionals and students committed to helping peers and patients register to vote and vote safely. And she's also a founding partner of the Sentibox Group, a social impact firm that transforms public health communications by elevating healthcare providers, scientists, health, and racial equity experts as trusted messengers. Dr. Amber Hewitt is the Chief Equity Officer for the Government of the District of Columbia. In this role, she works in collaboration with district leadership and agencies to apply a racial equity lens across government operations. In 2018, she was appointed by Mayor Bowser to the Commission on Fathers, Men, and Boys. Amber was the Director of Health Equity at Families USA, a nonpartisan national consumer health advocacy organization. She also previously worked as a healthcare lobbyist for an integrated children's health system. Amber's background also includes serving as an American Psychological Association, American Association for the Advancement of Science Health Policy Fellow in the office of U.S. Senator Cory Booker. She began her career as a tenure-track professor teaching undergraduate and doctorate level courses in psychology, social justice, multicultural counseling, and diversity issues at the University of Akron and Loyola University Chicago. Her research on adolescent identity development and well-being with a special focus on Black boys and young men has been published in several top-tier academic journals. A counseling psychologist by training, Amber has provided psychotherapy and psychoeducational testing for children and families. She received her bachelor's in biological sciences from the University of Southern California, MA in psychology from Boston University, and a PhD in counseling psychology from Loyola University, Chicago. She also holds adjunct faculty appointments at Catholic University, American University, and Simmons University. Thank you both so much for joining today. And I know I just want to, as a disclaimer, these folks are joining in their individual capacities, not in any official capacities, and they'll be sharing their journey as a healthcare provider and professional and just their path through not only healthcare, but also policy and advocacy. So I'm so delighted to have both of you on today. Thank you so much for taking the time to join us this afternoon on a Sunday morning, afternoon, wherever you are today. We'll start off with an easy question. What is your background? I know I just shared your wonderful bios and very impressive, might I add, but could you share a little bit about your background and which area of health professions you are in?
I can start. Good afternoon, everyone. It's afternoon on the East Coast. I'm here in DC. So Raashmi, first, thank you for having me. It's great to be reconnected with you and see you on your own journey. Raashmi did a great job of, summing up my professional background. So I'm a counseling psychologist by training, and you may have sort of caught this in the bio. I started out on the tenure track. So when I was in graduate school, I was leaning more towards research and teaching. So I started off for 3 years on the tenure track at the University of Akron in Ohio. After that, had a career change from being a counseling psychologist and a professor. I was also working part-time in a community mental health clinic in Akron, Ohio, but did a career change to working on the Hill in DC. So I spent 3 years on the tenure track, working with clients and families, primarily Black and Latino clients and families, either in a community mental health clinic half-time, and then the other half-time, I provided services in schools, so some psychological testing, family therapy, group therapy, but did a career transition to do a fellowship on Capitol Hill. Resigned from my tenure track position 3 years into it, and since then have been full-time in the policy and advocacy space. And I don't want to steal too much of the other questions. I can talk a little bit about that transition, but I think that question is coming up next. But I'll say one, I guess, key thread between all of my professional throughout my professional journey has been social justice. So what's not included in my bio is that I'm a daughter of parents who came of age during the civil rights movement. I grew up in the deep South in Shreveport, Louisiana, by parents who sort of navigated segregation, blatant discrimination and racism, and hearing their stories and how they advocated and created change in their respective professional organizations and their communities. So that was a big part of my socialization, and I think that has led me to where I am today, working primarily in equity policy and advising the mayor through a racial equity lens.
It's an honor to meet you, Amber. It's a pleasure. And Raashmi, thank you again for the invite. And I'm so excited to see you embark on your new journey, and always will be here. Thank you for the intro. So, what's not on my bio is I never wanted to be a doctor. I actually was a musician. I went to Berklee College of Music in Boston. That was my first career. And I got hit by a car when I was in my early 20s. So I'm here dating myself at this point. I'm now 50 this year. That actually was one of the most highlights of my life, just because it allowed for me to really take a different path. So I enter into the health space through this lens of being a patient. And during my journey of being hit by a car, I got dropped by my health insurance as a pre-existing condition through no fault of my own. I had 4 open hip reconstructive surgeries. And so I learned this journey of being a patient and what it meant to navigate through a system. I have to tell you, I come from a space of privilege. I'm born to immigrant parents. My mother was a doctor. But even just then, it was very hard for even her to figure out how to help me navigate through the system. And as I went through this journey, I realized that this was just such a bigger issue than me. And so I became a patient rights activist and an advocate, and decided to go to medicine, not because I love medicine, but because I loved people, and really wanted to make sure that that the work that I did, or anything that I did in this space called medicine or health, really came from a lens of justice and a lens of making sure that those who are not being heard or seen are going to be heard and seen. And I wanted to be a part of that rise up, if you will. And so that's really where my whole career is. I trained in social medicine, family medicine, and I've been very intentional about making sure that the spaces that I'm in actually still aligned with all of the work that really goes towards social justice and racial justice and health equity. And so that's kind of my journey. And I haven't really veered far from that still. So I think that's kind of where I'm at. I'm in a lot of different spaces and places that sort of behind the scenes trying to help push some of the levers, whether it's in a government space or a community space or anything else in between. And so that's my journey, and that's where I'm at now.
Thank you both. I think I know you both haven't met before, but there seems to be, a lot of overlap, which is why we chose both of you. And I'm really excited to kind of dig into the various, offshoots and routes that you had along your path. So that's kind of my next question is, I think Amber, you kind of hinted at this, Manisha, both of you hinted at this when you were sharing a little bit more about yourselves, but did you always know that you wanted to be a clinician advocate? Can you talk a little bit more about your transition into, from healthcare into that space? And I know both of you mentioned that you are coming into, these spaces of healthcare and policy and advocacy from a social justice, and really that's your priority. But I think hearing how you made those transitions and why you made those transitions would be really helpful for specifically our learner group who might be trying to figure that out for themselves.
So I'll go first if that's okay. Yeah. So I don't know if that term clinician advocate or physician advocate, like it was a sort of a term that's given to you, right? But I mean, I was very clear and intentional about why I'm in this space. There is a molding that occurs into this space, right? You step into say, and I just never fit the mold. I think I was older. I went to med school in my 30s, early 30s, and I just never fit whatever it was that was sort of, I would argue, being imposed upon me. I'm supposed to think this way and do this thing this way. And it just never sat with me. So, what I did was I looked at it as saying, okay, why am I in med school? I'm in med school because I want to learn sort of the basics, the 1, 2, 3, right? That's the work that I'm supposed to learn. When you go to residency, the same concept. I'm here to learn how to think through this stuff. But I remember, I'm learning, and these are all the things I'm learning, but there's so much that I was learning that I will never do as well. And I think it's really important to remember to stay authentically true to who you are. And that was really my clear component. I think that I got called an advocate or an activist or all of those things, it's physician advocate, because it was like sort of a word but I was just doing what I know was right. And I was doing what I was talking about things that I knew that didn't feel right. And I didn't call it naivete or call it, ignorance, whatever you want to call it, or just call it that I was just standing up and being able to say, look, this is, first of all, I was getting too old. I feel like that sometimes. I mean, you guys hear me say, I'm like, oh my gosh, I'm perimenopausal. I'm old. I'm too tired for this. Like, I'm just going to keep and so the thing about it is, it's like, I think that part of that feeling of, when you're in these spaces is to always remember who you are, why you're stepping into this space. And it's really important to then also find that safe space that you can actually go ahead and just say what you got to say to keep it moving. Remember that these spaces of education are not forever, right? It's just a stepping stone to the next spot. And so I encourage that, but so I think that that's how I became one, not because it was like, oh, it was this word. It was just more like I was very intentional and aware of why I was stepping in this space and what I wanted to do, for better or for worse.
Manisha, it's great to meet you as well. And I definitely hear some connections and synergy between how we've approached this. And I'll just build upon what you said around being true to yourself. I think that's something I continue have to remind myself of. But Raashmi, to answer your question, no. And I think we've had this conversation personally as well. But no, I did not imagine that I would be working in advocacy. I always had a leaning towards systems change, even though I wouldn't call it that. Like all these words that we have now to describe like advocacy, social justice, systems change. I didn't have that language early in my, I guess, career development. I thought I would retire 30 years from now as a tenure track professor. Like that's maybe not at the institution that I started at, but that's where I saw myself. And I think that was because I put myself in a box. So I'm a counseling psychologist. So I only allowed myself to consider two options, either full-time clinician or full-time researcher in the academy. And I think once I was like exposed to other options, exposed to psychologists or health professionals working in the advocacy space, I don't know, it just opened up more opportunities and possibilities. Also, as a woman of color, a Black woman in the academy, it was hard for me to leave. I felt like I was like letting my people down, just to be honest. And I had my my research and faculty advisor, who was also a Black woman, you know, say, Amber, you don't have to hold the weight of the community. You don't, this isn't a moment for you to feel like you have to hold the weight of your community on your shoulders. And that was just very a freeing moment for me, because at that time I was considering resigning and going into the Capitol Hill fellowship. But I would say, if I think about like the connection between where I was as a health professional working in the academy to where I am now, I think I will mention the things I said before, like my own racial identity development, my racial and gender socialization experiences, but then also my critical consciousness development as well. So I grew up in a very sort of color conscious, race conscious family where we talked about injustices. I didn't know that was not, I don't know, to me that was normal. And I talk about race and racism all the time. And I'm in district government, and I know that's not the norm in different agencies. So where my colleagues work. But I say that because, similar to what you said, understanding systems change and having the lens of justice. So working with the clients and families that I was working with at the time, understanding that the barriers that they were facing, the differences in outcomes that we were seeing, were driven by structural and systemic factors, a history of exclusionary, discriminatory laws and policies, let alone the bias and what happens at the institutional level. So I would say that sort of catapulted me into this new space. And then, Manisha, you mentioned navigating through systems, but also understanding that systems are designed to maintain the status quo. So I wanted to be a part of that process. And it's not easy. I mean, it's not easy working in this space. But I think about the long-term win, if you will. But what keeps me going is that, especially in local government, I'm able to have just smaller wins than I was when I was sort of working in the federal policy space. So that's a little bit of how sort of I came to where I am to be today.
Thank you both. That was really, very insightful for us to hear about your path and how, some of it was intentional in a way, but a lot of it was not. And it just was, it came your way and you chose to follow your instincts and what just felt right for both of you, and found your space, through your journey in that, using that as your guiding force. I know both of you kind of touched on this a little bit, but of course, staying true to yourself in these various spaces of academia and within, the health profession space, and even just policy and advocacy, can often come with a cost and just significant barriers of, doing the thing that's right and that feels right to you. And that is, your personal and your mission, really. I want to ask about how you both kind of navigated some of those barriers. And I think, at least for me, as a incoming learner into this space, I feel like I'm going to be told to not be myself. And I think a lot of that serves as, that is a kind of a barrier for a lot of my peers and folks that might be kind of toying with this. I love this stuff. I want to get involved in it, but, I think that my residency program director is not going to be super thrilled about that one day. Or, there's some of those power structures that exist within, I'm kind of saying it in the context of medicine, because that's what I'm entering into, but I'm sure they exist in other power structures as well. The system is, of course, as we know, designed that way. But I think it would be really helpful for you to share some of those pushbacks that you might have faced along your path, and then also just how you found peace within yourself in continuing to do the work, but then also leaned on, maybe outside supports and structures like the community with which you guys have been working to really help you continue fighting the good fight.
Yeah, so I'll answer that because I think I pushed a lot. So for those of you who know me, So there's a couple of things. One is like, is the push worth it at this moment? So one of the things that I always ask is, especially med students or any student, pre-med, anybody who comes sort of at me, is that I just want to know, whatever it is that you never, all ideas are always good. This is that's the beauty of ideas, and the beauty of really thinking about the things that matter to you. All of it's good. Never dismiss them. Sometimes though, the timing's not always right. So it's all about like putting some of it in a parking lot. Can it come back? Is there too much of a cost for you? Like in terms of you personally, collectively, is it at a cost? And so I do think a lot about like, that's where strategy comes in, right? Where do you push? Can you push here and let it be? And then the other stuff that you really want to push, you can move forward later. Like it's not, this work isn't going to like go away. This is like, we're undoing 400 plus years of stuff. How old is this country? Sorry, something to that effect. So, but the point is that, and in an education system, remember that part of education is to learn the things that you would never be a part of. It's not just to learn the things that you're learning, but it's also learn things that you're never going to be a part of and what you're going to do to make it change, when you can, right? And it's like, or finding like-minded folks to do that work as well. I will also tell you that there are champions within the education system, and I would take the time to seek those champions who are in spaces of power and influence within the education system, for better or for worse, but just understanding, like, are they a champion for your cause? Because you're going to have alignment somewhere to move some of those needles. I'm sorry, Isha, can you turn it down, please? Thank you. And so, sorry. So then the other piece also is that I think that don't be scared. Like there's probably, you're not alone. I honestly, like there's going to be more folks who think like you or want to do things like you. So being a part of a collective that actually allows for that, or knowing people that can connect you to those folks, I think it's really important. Networking is really key that way. Because the thing is that more chances that if you're thinking and feeling this way, there's 10 more that are feeling and thinking this way as well. And then that's just part of the work, is to find that collective who have like-minded, because remember, power in numbers is really key. There's pressure that comes with that, whether you're in a political system, an education system that is a political system. Somebody mentioned little p, big P politics. There's a lot of that happens within institutional settings. So when you step foot into your education system, start looking for folks that share the same interests as you, don't isolate yourself from that. And so I just encourage you to do that. Remember that the journey in education is forever, it's lifetime, and it's not an institutional education is just a hoop that you have to jump through to get to the next spot. So I just encourage folks stepping into it, knowing that this is just some of the things we got to do because the system's set up that way. But I also want to say that it's never an either or. When I was going through the education system, I kept being told, well, I was working with the Obama administration. We were doing Dr. Sharma. I was doing a lot of these things outside of residency and outside of med school. And I remember this one guy saying to me, who was an educator and attending, he was like, well, you've got great potential, but if you could just stay here, you can start from the bottom and make yourself work your way up through leadership. And he's like, it'll be good for your resume. And I had to ask myself this very hard question: this guy's a nice guy, I've learned a lot from him, but is his career what I want for me? And because I'm learning at the feet of good people, like in good trainers, but are they doing what I want to do? And if they're not doing what I want to do, they're the wrong people to be talking to. And so I say that to you because that's all they know is what they're doing. So I really encourage you to build a network, seek talk to people, go outside of your comfort zone, because that'll allow you to expand and think through keeping authentic to yourself. It doesn't have to necessarily always, because that really does connect you to being authentic to yourself.
Well, I definitely agree with talking to as many people as you can, network, going out of your comfort zone are all critical pieces. Raashmi, what you said around the pushback, so the fellowship that I talked about, so the fellowship through the American Psychological Association that places 2 to 3 psychologists on the Hill every year. I was applying for that, and one of my colleagues at the time, who I deeply respected, was more seasoned in the field, she said that she would write a letter of recommendation for me. When it came time to write the letter of recommendation, she backed out, saying, "I don't know. Are you sure about this? I thought you wanted to, I thought the tenure track was what you wanted to do." So she did not write the letter of recommendation for me. So I could have, listened. Well, I could have interpreted that as, okay, maybe this isn't the right time and I won't apply. I had another colleague who I didn't really have a close relationship with, but a good enough rapport where she wrote a beautiful letter of recommendation. I ended up getting the fellowship. And I always go back to that point because I just think my career trajectory would be completely different if I hadn't listened to myself or had been willing to go out of my comfort zone. But I do have a slightly different take on ideas than what Manisha said. I don't believe all ideas are good ideas, because I think sometimes, I guess putting a value on it isn't as important, but just understanding that when people are sharing an idea, they're coming from their own perspective. You don't know what's driving that. You don't know what factors or what has shaped them to have that interpersonal dynamic with you or why they're sharing it. So maybe I'll step back and say, I guess I don't want to put a value judgment on folks' ideas, but it's good to understand that it's good to question the idea. But I think another thing that can sometimes feel overwhelming is, how do you get involved in advocacy? Or I think that can be very overwhelming because there's just so many things to work on. And how it looks like for me may not be what it looks like for you now or in the future. So I think just opening yourselves up to the realm of possibilities of what that could look like. So what you work on, how it looks, what it will look like, may look different for different people.
Yeah, I want to add to what Amber's saying. I don't have enough coffee, so my apologies. You're right, absolutely right. I guess what I was trying to say is, everyone has a right to an idea, and it's really basically like, so I'll give you an example for myself. I'm sorry, I'm not being articulate, but what I mean by that is that everyone has a right to ideas. So don't feel personally that if your idea is shot down, so I don't get married to ideas. So I'll put an idea forward, and Raashmi will come out with an idea, and Amber will come out with an idea, but I never stick with if their ideas are like, wow, that's a great way to think about things. I'm not married to my idea, right? So part of this work is being able to understand when to step back, when to step forward, being able to understand being a part of a safe collective that has the same shared themes and ideas from you as you. And so when you feel this pushback, it's really about putting out these a strategic way to move forward and push in a collective response, right? And so why I say that is that, but it's not sometimes we step into these spaces with ego over how we're going to do things. And I think that's all I'm trying to say is that it may not work now. It may not be an idea that you have. If you really are passionate about it, great. But also understand that if the space and place that you're in is not the right timing for it, then don't be married to it is what I'm trying to get at. So yes, I agree.
Thank you for, both of you. I like this little back and forth that we have going. No, and that's really what I want this panel to be, is more of a conversation. Thank you for sharing that. I think that's definitely, Rob mentioned he's taking copious notes. And I think that, it is really helpful for a lot of us to hear these different strategies and advice that you have as learners in this space, and folks, even about to enter it like myself. I want to go back a little bit and switch gears to talking about, I know both of you have had extensive experience just working in the community, and that's a lot of what drives you today seems to be, that community work that you've done. How would you, I think a lot of our learner audience, at least that are here, and I'm sure we're going to be watching later on, are driven by that similar, community-based mindset. What kind of advice would you have for them to continue working with, their community-based, continuing their community-based work and kind of tying that in with advocacy, and how those two can kind of fit together? And it doesn't have to be an either or, but a this and. So if you could both share a little bit more about, Amber, I know you've done some community work where you started your career in Ohio, and Manisha, I know you've done a lot of community work as well. If you could just start by sharing a little bit of those, just a few more details on, what you did, and then how you're still kind of tying that in with the work that you're doing today.
I can jump in, and thank you for the kind words in the chat. And I think what Manisha said around not seeing things as an either or is so powerful. But when I think about community-based work, particularly in my space, working as a policy advisor to the mayor and providing technical assistance to district government agencies, in order for me to do my work well, I have to be tapped into community. So we defined racial equity as both a process and an outcome. So we will know that we will have achieved racial equity when race or ethnicity no longer predicts opportunities, outcomes, or the distribution of resources. But it's also a process where we meaningfully involve those who are most impacted by our policies and programs into government decision-making. And that sounds, very intuitive. Yeah, if you're designing policies and programs, you should include the perspectives of those with lived experiences around these issues. But that has been, I wouldn't say a challenge, but there've been many opportunities to sort of push colleagues on how community engagement has traditionally been done in government. So how, I'm sure you all have heard the phrase, people closest to the pain should be closest to the power, and people closest to the pain are also closest to the solutions around what's impacting them. So I think it's critical to have that connection to really lift up those perspectives. So I would just say it's just a really critical part of my work when it comes to embedding an equity lens into government operations. And we think about different equity tools. Stakeholder engagement is a key piece of that. So, but I also know that there are push and pulls from the various institutions on community partnerships or being embedded in communities, and, these made up hierarchies around what that looks like. So I just want to acknowledge that. I understand that may be challenging to continue in certain spaces.
Yeah, so a couple of things. I think, so my angle again is going to be being a physician. So we're pushed into these systems where we're supposed to educate a certain way, we're supposed to train a certain way, and there's some understanding of why that is, and I understand that. But one of the things that I think is really important is that we're given a lot of choices, as if you're supposed to be 100% a clinician, or you're supposed to be 100% an academic, or you're supposed to do like these 100% of stuff, right? And what I realized, I had a really good friend say to me, because I was so unhappy, like I was just like, I don't understand why I can't do a little bit of everything that I feel so much love for. And then she was like, well, it's not built for you, so you need to build it. So basically so I realized what that meant was I don't have to be all under one house or one roof to do certain things, right? So I still see patients because it keeps me humble, number one, and number two, it really educates me for the things that I do at a systems level to design and to build and medicate. So I'm in the space of Medi-Cal, which is in California. It's the Medicaid of California. In order to do that work, I got to understand what it's, you've got to be at the place that it affects the most, and that's in the community. So, and I love patient care, But I just don't have to do it all the time. I do it. I also do it as a volunteer. Part of the reason I do it as a volunteer is because it brings me joy. I don't like people telling me what I need to do to take care of my patients. Like I want to do it in this way that feels, but I also have to pay the bills. So there's all these things, right? And so I think, I think what's really important is that for me, being tied to the community really allows for me to do the 30,000 foot view work. And I have to do it. I have to be tied to the 5 foot view. And so that 5 foot view keeps me humble, gives me lots of humility, and it allows for me to build for things that are sort of, higher. And if I feel like I'm going right, like if something's not going right, I go right back to the 5 foot and say, yo, this is what's happening here. Does this feel right to you? Right? Like, it's like, and then being able to have them be a part of the build, right? It's really important. I think a lot of times we sort of have a very top-down approach. And so I'm a ground-up person. I don't think it resonates well, to be honest with you, in C-suite places, and that's okay. I'm not interested, like, what you see is what you get. And if you want me to be in C-suite, you're going to see what you see is what you get. And so, and part of what you see is what you get is that I'm always tied to the ground by being able to hear and see and ask them what do they think is, what is it that they feel like is the right way to build something, and bring them with me. So I do community work because it just keeps me grounded very clearly. And if I don't touch the community, like, or I'm part of the community. So it's like, if I don't take that lived experience to the spaces that think that they're doing the right thing by people, I would be bad on my part. Like, it wouldn't be a good thing. So did I answer your question? Sorry.
Yes, no, it definitely did. Thank you both. In the interest of time, I'm going to ask one more question, kind of along the lines of community building, and then I'll open the floor to our learners and just other folks in the audience who might have questions as well. Talking about community, one thing that SMA is really prioritizing right now, and I know you might have heard this in the first half of our event, but our student assembly is really the community we're trying to build for learners for along various paths within the health professions education space. And, whether that be pre-health or in graduate education or, in their residency, or postgraduate education, we really want to create a community for, 2 reasons. One is to support them as they navigate their own path and journey. But also 2 is, give them the tools and help them hone in on things that they're interested in, like policy and advocacy, but might not know where to start. And so this, of course, is a great event that's kind of depicting that as our priority. We really want to host events like this to get folks really excited about this work and give them the tools to actually do something with that interest. And then, of course, we have our virtual Hill Day Summit tomorrow. That's going to be a continuation of that. But I wanted to ask both of you how else you think that, the Social Mission Alliance and our Student Assembly, as Rob and I, and Zina Ahmed, who's one of our former health justice fellows, who's also helping to really build out this community with us, how we can all support learners in that space and help them kind of do what you guys are doing. And, if that's where they want to go one day, how can we think about that as an organization and as a community that we're trying to build?
I mean, from what I've seen and heard so far, you all are on an excellent track. I'm very encouraged by the work that you all are doing, that you're having conversations like this in the virtual Hill Day tomorrow. And I think that just that exposure to speaking with legislators and their staff is critical, because how you may communicate in your professional settings is not always the same way as you communicate with legislators. And I always reference, I wish I had the visual, but how we're trained to write research papers where, you spend all this time building up to your conclusion, but when you're with a key decision maker or a legislator, it's sort of the reverse of that. So what is the, so what are you asking me to do? What do what bill is this about? Or what funding source, and then bringing in sort of that background information and that stories. So that's been a learning. I had to learn new skills, but also my skills in psychology, I've been able to sort of transfer some of those skills, but it's a different, I find it to be a different way of communicating that I had to hone over time. So I think having the virtual Hill Day is a great way to have that exposure, as well as understanding like whatever your clinical area of interest is. So sort of what's going on at whatever state that you're in or the federal level that's tied to that. So I think understanding, just something as simple as, what committees have jurisdiction over the topics that you care about, and understanding what hearings or what big bills are coming up. So just getting yourself trained to sort of understand some of the political legislative language will help you be a better communicator and a better advocate.
Yeah, I think, so I agree with Amber. I think the Social Mission Alliance is just it's important for spaces like this to be existing, right? I mean, because again, it's, the answers that we have are not necessarily always in the space that we're in, right? Like in the education systems and institutions that we're in. I really believe it's outside of that. And you need exposure and networking ability to exposure and opportunity to do all of these things. And so what I think the Social Mission Alliance is doing is creating opportunity. And I think that that's really important. I also think stay consistent. What do I mean by that is that, making announcements for events and things of that nature are awesome, but there's also an and piece to that, which is how many people are you touching? 5 people a month to be able to say, you find students that you meet and you're going to say, hey, I want you to come to the Social Mission Alliance meeting with me, because the things that you're talking about are things that we talk about, and it feels safe to do so in this space. We used to do that a lot when we were Doctors for America, and how we built was based off of the fact that, many of us who were already established in our careers or just up and coming in our careers, we just made it an intentional effort to go and reach out to people that we saw that were struggling. Even if you just see them struggling, just, you see their faces, students' faces, they're just feeling overwhelmed. Go sit with them, have coffee. Sometimes it's just as organic as that. And then think about the other things are, to Amber's point, there's definitely different ways to communicate in different spaces and places, right? You're not going to communicate with a politician the way you're going to communicate with your patients. It's just different. People speak languages, if you will, in different ways. And I think being exposed to the way you can articulate your points, ways to put your ideas across, or the things that you're pushing for, agendas, if you will. It's really important to be exposed to those places so you can learn that language of what it is that you got to do to sort of push something forward. And so be creative in the way that you build communication. So Rob and I always have this conversation. It's like, I teach media, right, to physicians and to nurses and anybody in healthcare, on what it means to be on TV is a very different way to communicate than saying being in an exam room, right? And so why I do that is because I think it's important to remember that people receive and perceive information very differently. And sometimes it's being given opportunity to learn how to communicate that in a way that people can perceive and receive, is really great too. So I think again, a lot of it is high touch, warmth, organic, and opportunities, and constant opportunity. It doesn't have to be big. It's just as valuable if it's a small moment of opportunity. So.
Thank you both. That was super incredible to hear, both of your experiences, and very surely inspiring and hope-inducing for me as well. I'm going to turn it over to the audience. I don't know if folks, oh, we got some claps coming from the audience. You guys are fantastic. I'm so glad that I was able to share the space with you. But let's turn it over to the audience to see if any folks have questions. Feel free to come off of mute and just ask, or if you feel more comfortable dropping it in the chat, feel free to drop it in the chat. We will ask them out loud for Amber and Manisha to answer.
All right, my name's Ike. I wanted to say thank you to both of the panelists for being here and sharing so much of your wisdom with us. I learned a lot, and similarly just taking notes and then trying to put into practice. I think just sort of touching on what Raashmi asked earlier about being someone who does both community work and also like the advocacy and political engagement. I apologize for the background noise, by the way. I think personally, I recognize I'm someone who the community work just sort of comes a bit more naturally to. It feels like breathing to show up for people and to be with people and to like be down on the ground. But like brushing up against institutions and brushing up against the legislative process or the political process isn't as natural, although it feels essential, because I do think medicine and like health professions are inherently political things. And so I guess sort of how do you find yourself balancing wearing both of those hats, and also how do you find like reprieve and rest from being those things that are both critically demanding? Being one of those things on top of being a health professional alone, I feel like would be enough for a lifetime. But when you find yourself needing rest or finding yourself pooped out, like, how do you come back? How do you pace yourself? How do you step away? Kind of all of that.
Yeah, no, I'll take that one. So, it's a great question. So I will also tell you that, so before I had a kid, that was it. That's all I did was like social justice work, worked in DC, did a lot of, and it was exciting. It was a very sexy time. There was so much that was like happening. And I had a kid and it rocked my world, like in ways that I can't even begin to tell you. And it also, it really gave me perspective over what's important in my life, like in terms of, when I talk to young students, it's so funny when I'm like, so tell me a little bit about yourself. They rattle their CV, right? And I use something that Rob said to me once that I really loved, which is, I'm a constellation of identities, right? And I truly am. So being a doctor is just something it's a skill that I have, right? But it's not my identity per se, right? And so I think it's an honor to be a doctor and have skills and to do the things that I do. But I had to really take a moment to like step back a little bit and take perspective over who am I? What am I about? How do I think about these things? What am I doing to raise this amazing human? And how am I teaching him to be kind and good and a good human in the world? Like my trajectory is really taking this other way of thinking about things. To get rest and reprieve is really being really intentional to myself. So I will tell you that once I had a kid, it rocked my world. Politics didn't. It took a sidestep for me. It was just not. It was just about this thing that we created. Like it was just amazing, right? Like, and it was like, so there's a time and place for everything. I will tell you that this work that we do in social justice will never end. So if you take a step back and you plug yourself back in, honey, you're going to definitely be plugged in, and there's no FOMO. I used to think that there was just going to be this FOMO, like, oh my gosh, I'm not going to be able to be a part. It's not true. I can tell you that this work, and especially if you are in a village and a collective, when you share that work together, taking a step back, everyone will support you. And I can assure you that. And when you're ready to come back in for whatever you can give, I always talk about this work being like going to the gym. When what I mean by that is that you know, we dedicate, you know, if you like going to the gym and you dedicate 3 days a week to go to the gym, it's this dedication 3 days a week. You go to the gym for 1 hour. If you're doing social justice work and you're doing it for 1 hour a week, that's awesome. That's joy, right? If you do it if you can only give 5 minutes a week, that's awesome. That's joy. You don't have to give a lot to do this work. And so I say this to you because I think a lot of how do I balance? I think a lot of it is just taking a step back and reflecting what matters to me right now in this portion of my life. And then being able to think through how much of that time can I give? There are times my sister had died right before COVID. She was killed. And I was like off the radar. That is all I needed I just needed to get off the radar. And I did. And until I could put myself together. And this is during a time where COVID, the lockdown, and everyone, the state was calling and saying, I got to go to the front line. And I did, I tried. And I had a breakdown, and I couldn't process watching people dying in front of me. It was too much. Like, I just couldn't. So I think it's okay to stay vulnerable and truthful to yourself, and finding balance, just like I did this weekend. Like, you know, I just needed to see the ocean. So I was like, we're going, like, and being able to, and don't be apologetic about it, because you don't need to be. And so I say that to you, is that I think a lot of it is more of what matters to you. You are a big part of it, and what can you give? And understand that whatever you do give is enough. And I think that that's really important to understand that. And it's okay to say no. It's okay because when you don't say no, that means you're saying yes to something else, and you're saying no to yourself. There's joy in justice. It's not a competition. It's whatever you can put for yourself. And it doesn't have to happen all the time. And so I say that through a very hard path of understanding it. And so again, it doesn't take much. It can take a lot. It's up to you to decide what you give. But remember that whatever you do give is enough. And so I say that's the way to start to think about it. That's at least for what I've done.
And I don't think I can add anything to what Manisha just said. I appreciate her being so transparent and vulnerable.
Yeah, I don't really have the words to express my gratitude for what you just said. So thank you so much. I appreciate that deeply.
Thank you all. Thank you.
You guys are amazing. My heart is just so full. It is just bursting on this Sunday afternoon. Very grateful to be able to share the space with you today. Any other questions? Any comments? Any thoughts?
I just want to say thank you both for being so transparent, being so honest. Everything you said is really reminding me of things that, like, I felt, things that I've questioned or whether they're right or wrong. So hearing your reflections and hearing your conviction and hearing how you're, holding on to this path is extremely rejuvenating for me. So thank you so much.
I want to offer myself. And what I mean by that is I'm here. I just want you to understand that this is not a journey to be by yourself. I can't stress that enough. It is really critical that you step back and look in your own life. What is bringing you joy and what is exhausting you? And the thing is because we need you. We all need each other to do this work. It's really critical. And so I say this because I need you to know, and some of you have already, I have good, great, deep relationships with your family, like, because I want you to know you're not alone. And each part of your life cycle is going to be uniquely different. But staying true to yourself is this work anyway. It's just, this is why you're here. So you don't have to convince anybody of that. It is who we are, right? And that is the floor. But how you decide to do that on your journey, just remember that if you feel alone, just look around, because I'm telling you that you're not. And you're here at this Social Mission Alliance because you're not alone. And this is important, right? And even after, like, I haven't heard, like, I didn't hear from Rob for years. I hear from Rob. It's like, it's as if it was yesterday. It's not. Reach out, please. I will find ways to talk. Everyone knows me enough to know I've got a 7-year-old running in the background. Yes, but you text me, I will find some time. I may be a hot mess, but I will find some time. So it's like, so I just say this to you because I think it's really important that you lean on each other and you build and you find other people who may need you as well. That's part of it, right? The reach out. Sometimes you'll be surprised by who you find who just needs that warm hand and touch and saying, hey, come through, come with me, let's do this. So I just encourage you to think that.
And I'll just add on that briefly that, you know, working to advance social justice is not a solo sport. It's a team sport. And don't be afraid to ask for help. And this is from someone who struggles with that on a daily basis. And I would say also be mindful if you're called to do this work and you're the only person there and there's no funding around you. Luckily, when I came into this role, I was able to have a budget for a team, and that can just feel so isolating when it's just you, because this is emotionally draining work, systems change work. So definitely find your community, and also don't let folks, diminish you or feel less than because you are, doing something different or, using your roles in a creative and in an innovative way that they may not be doing or have thought of. So I don't know, I'm inspired by all of you as well. I actually have not retained my license since being in Ohio. Since being in DC. It's been on my 6-year to-do list. So you all are inspiring me to turn in my paperwork to renew my license here in DC. But just thank you so much. I received a lot from you during this conversation as well.
And I have to say, on a personal note, I am so lucky to have both of you. I texted both of you were so excited to be here, and I'm very, very grateful for that. And I think that this was just an amazingly vulnerable, genuine discussion that I think a lot of us were very much in need of. So thank you both for providing that very refreshing conversation for us today. I don't think I see any other hands in the virtual room up, so I will say that we are going to close out for today. Thank you both to our big round of applause to our panelists, both Manisha and Amber, for being here. I also want to do a very quick shout out to my team, our Hill Day team, our Zina Ahmed, Rob Rock, Florence Tyler. I'm not sure that they are on today, but we would not have been able to do any of this without you guys. And of course, a huge, amazing, big thank you to our Advocacy Advisory Council as well for all of the amazing efforts that you've put in over the last couple of months, and help us prioritize for what our advocacy strategy looked like and what our priorities actually looked like as an organization as well. We're very excited for this new chapter for our organization, and just as individual learners too. I mean, for me personally, and I'm sure I could speak for a lot of us who are learners in this audience, that we're very excited to continue this work. So thank you all for being here. And Rob and I will stick around, and we have a couple of other things planned for this afternoon, but feel free to hop off if you have other things to get to. Thank you so much.
Thank you.
Everybody, much love.
Yes, thank you all. Thank you all so much.